Well, my name is Wayne Kelley. I took a little different background than most people. Out of high school, I went directly into the Navy as a hospital corpsman. I spent 8 years in the United States Navy as a hospital corpsman and x-ray tech. During that time, as an x-ray tech, I worked in the ORs. I got to work with orthopedic surgeons, and I knew at that point that that's what I wanted to do, is to go into orthopedics. You know, the one thing I didn't want to do when I was in orthopedics was spine, but when I got into my residency at Duke and we started actually on a rotation working in the spine clinic, I had the best time ever. At that point in my career in residency, the spine surgery was the new technology that was coming out. We were doing motion preservation, we were doing minimally invasive surgery, we were doing large scoliosis surgeries, and the age groups were young to older. The problems we were dealing with were both neck and back, and it's just a different variety of cases, the different age groups you get to deal with. So it was just the spectrum of the cases, the technology, the amount of effect you had on people's lives. Well, I guess I get a lot of times, is, what to expect out of spine surgery. A lot of people are thinking, oh, if I have spine surgery, then my life's over. And it's quite the opposite. The whole goal of doing spine surgery is to restore your function. Our goal is to keep you productive, keep you active. We want you to be able to get out and do things that you enjoy, get back to work. And so that's a misconception that once you have a spine surgery, our goal is to restore you, to get you back going and keep you active, keep you healthy so you can enjoy a healthy, long life. Well, there are lasers that are used in spine. It's rare that they actually use a laser. Typically, when we hear the word laser, what we're really trying to say to the patients and people is minimally invasive surgery. And so as we're got newer technologies, more advanced technologies, we've sort of switched from doing open cases to doing more minimally invasive cases. And so it goes by many different names, but the whole goal is to do the same amount of surgery that we were doing with large open surgeries in smaller incisions, less blood loss, less hospital stay, quicker return to work, quicker return to normal function. And so really when I hear that, I'm thinking minimally invasive. And minimally invasive is what we do here at OrthoGeorgia. There's no reason to leave Macon, Georgia. Again, when I came here and interviewed, I'd been at a lot of major academic facilities. I'd been from Illinois to California to Duke University. And when I came here and interviewed for a job, that's what kept me here, is that when I go out to this community, we've got all the subspecialties, we've got great doctors here, not just orthopedics, but all around us. And so as a medical community, we've got the ability to handle anything that comes our way. We're in the center of the state, and what that allows us to do, allows us to branch out to serve our community, not just our local community, but also branch out to those that maybe have a hard time getting to us when we go to them. So we've got offices in Milledgeville, Warner Robins, Dublin, Griffin, Georgia. We've got offices outside of here where we can expand and see patients there so they don't have to travel as far to see us.